I paid $0 for surgery in New Zealand. My American insurance would have charged $47,000. This scar saved me $47,000. And I'm about to show you the hospital bill that proves the American healthcare system is absolutely broken. I'm an American who needed emergency surgery abroad. And what happened next completely shattered everything I thought I knew about healthcare. By the end of this video, you'll see the actual bills, the hidden costs, and why this could happen to you.
So here's what happened.
I'm
living in New Zealand on a 2-year
work visa, working remotely, when suddenly, excruciating pain.
We're talking can't stand up, sweating bullets. Something is seriously wrong kind of pain.
Something is seriously wrong kind of pain.
I'd be panicking about which hospital
Back
is
in the
in
States,
network,
I'd be panicking about which hospital is in network,
and how much of my
whether I need
$6,000
pre-authorization,
deductible I'd already
and how
used
much
that
of my
year.
$6,000
But I'm in New
deductible
Zealand.
I'd already used
I
that
do something
year.
that would be insane in America.
But I'm in
I
New
go to a
Zealand.
public hospital, and
So
I
I
don't
do
even bring my
something that
wallet.
would be insane
I
in
walk
America.
into the ER
I
at
go to a
11
public
p.m.
hospital,
expecting.
and I don't even bring
Honestly,
my wallet.
I don't know what I'm expecting.
I
In
walk
America,
into the ER at
just
11
walking
p.m.
through those
expecting,
doors triggers
honestly,
a $3,000 facility
I don't
fee
know what I'm
before anyone
expecting.
even looks at you. The
In
intake
America,
nurse greets
just
me,
walking through
takes my
those doors
information,
triggers a
and here's where it gets
$3,000
weird.
facility
She
fee
doesn't ask
before
for my
anyone
credit
even
card.
looks at you.
She doesn't ask for my insurance card.
The intake
She doesn't
nurse
mention
greets
payment
me,
at all.
takes my
She just
information.
takes me in. Within
And here's
30
where
minutes,
it gets weird.
I'm seeing a doctor.
She doesn't ask for my
Within
credit
2
card.
hours, I'm scheduled for surgery.
She doesn't ask for
the
my
surgeon
insurance
explains
card.
my appendix is inflamed
She doesn't mention
and
payment
needs to
at
come
all.
out tonight. Another few
She
hours,
just
and this could
takes me
turn
in.
life-threatening. Within
30
6 hours
minutes,
of walking
I'm
through
seeing
those
a doctor.
doors, I'm in the operating room.
Within 2
They
hours,
operate.
I'm
They
scheduled for
save my
surgery.
life. I stay overnight
The surgeon
for
explains
observation.
my appendix
The next
is
morning,
inflamed and
they
needs to come
discharge
out
me
tonight.
with pain
Another
meds,
few hours, and
recovery
this could turn
instructions,
life-threatening.
and a follow-up appointment schedule.
Within 6 hours
and then
of
I ask
walking
the
through those
question that's been
doors,
eating at
I'm
me
in the
entire
operating
time.
room.
What do I owe?
They
The discharge
operate.
coordinator looks
They
confused.
save my life.
She says,
I
nothing.
stay overnight
You're
for
on a work
observation.
visa, so you're covered under
The
a
next
public
morning,
system.
they discharge
I'm
me
like,
with pain meds,
no, but I'm American.
recovery instructions,
I'm not a citizen.
and a follow-up
What's my actual
appointment
bill?
scheduled.
She pulls up her computer,
And then I
types
ask
for a
the
minute,
question that's
and
been
shows
eating
me
at
the
me the
screen.
entire time.
$0.
What do I owe? The discharge
Zero.
coordinator
Let me say
looks
that
confused.
again because my American brain couldn't
She
process
says,
it
nothing.
the first time. I just had
You're on a work
emergency
visa,
surgery,
so you're
a
covered under
full
our public
appendectomy,
system.
an overnight hospital stay
I'm
in
like,
a private
no,
room
but I'm
for
American.
antibiotics, pain medications,
I'm not a
post-op
citizen.
care, follow-up appointments.
What's my actual bill?
And my bill is $0.
She pulls up her computer,
Now,
types for
here's
a
the
minute,
important part.
and shows me the
I was
screen.
covered because I had a work visa valid
$0.
for 2 years or more.
Dollars.
In New Zealand, if
$0.
you're working there long-term, you
Let
get
me
the
say
same
that
healthcare
again
as
because my
citizens.
American brain
If I'd been a
couldn't
tourist,
process it the first
I would have
time.
been billed
I just
as a
had
private
emergency
patient,
surgery,
probably
a full
around $8,000
appendectomy,
to $10,000
an overnight
New Zealand
hospital
dollars,
stay in a
which
private
is about
room,
$5,000 to
IV
$7,000
antibiotics,
US dollars.
pain medications,
Still a fraction
post-op care,
of what I'd
follow-up
pay in
appointments.
America. But here's what's wild.
And my bill
if I
is
got
$0.
injured in an accident, like falling
Now,
while hiking
here's
or
the
getting
important
hurt playing
part.
sports,
I was covered
New
because
Zealand
I had a
has
work
something
visa
called
valid for 2
ACC,
years or more.
the Accident Compensation Corporation.
In New Zealand,
that
if
covers
you're working there
everyone,
long-term,
even
you get the
tourists,
same
for
health
all
care as citizens.
accident-related injuries. Completely
If
free.
I'd been a tourist,
Think about that. A
I
country
would have
that
been billed
protects
as a private
visitors from
patient,
bankruptcy
probably
if they
around
get
8
hurt.
to 10,000
What
New
concept?
Zealand dollars,
But wait,
which is about
it gets
5 to
crazier.
7,000 US
I get
dollars.
back to my place, and I'm curious.
Still a
So I
fraction
call
of what
my
I
American
pay in
insurance
America.
company. The one I'm still
But
paying
here's what's
$450
wild.
a month
If
for
I'd gotten
right away,
injured in an
and
accident,
I
like
asked them,
falling while hiking or getting hurt
hypothetically,
playing
if I had
sports,
this same
New
surgery
Zealand has
in
something
in-network
called
hospital in the
ACC,
US,
the Accident
what would I
Compensation
pay?
Corporation.
They run the numbers. Total
That covers
bill
everyone,
to insurance,
even tourists,
between
for all
$33,000
accident-related injuries.
and $48,000.
Completely
My out-of-pocket
free.
cost after insurance.
Think about that.
Between $8,000 and
A country that protects
$10,600,
visitors from bankruptcy
depending on
if
how
they
much
get
of my
hurt.
deductible I'd already hit
What a
in my
concept.
out-of-pocket maximum. Let
But
me
wait,
break
it
down
gets
what they would have
crazier.
billed. Emergency room
I get back to my
facility
place
fee,
and I'm curious.
$3,200.
So I call my
ER
American
physician
insurance
services,
company, the one I'm still paying
$1,800.
$450 a month
CT
for,
scan
by the
and
way.
imaging,
And I ask them,
$2,500.
hypothetically, if I had
Surgeon
this same
professional
surgery at an
fees,
in-network hospital in the U.S.,
$8,500.
what would I pay? They run the numbers.
Anesthesiologist, $2,800.
Total billed to
Operating
insurance,
room
between
facility
$33,000 and $48,000.
$15,000. Overnight hospital stay,
My out-of-pocket cost after
$12,000.
insurance, between
medications
$8,000 and
supplies,
$10,600, depending on how much of my deductible I'd
Total
already hit
hospital
and my
charges,
out-of-pocket maximum.
$47,000.
Let me
Now,
break down
insurance
what
would
they would have billed.
negotiate that down
Emergency
and
room
cover
facility
most of it,
fee,
but I'd still hit my
$3,200 for
out-of-pocket
physician
maximum.
services,
$9,200 for
$1,800 CT
2025
scan and
or
imaging,
$10,600 for
$2,500
2026
surgeon
under the
professional
Affordable
fees,
Care Act. That's the legal
$8,500
CAP.
anesthesiologist,
But even after paying $450 a
$2,800
month
operating
in
room
premiums,
facility fee,
I'd still owe nearly
$15,000 overnight
$10,000.
hospital stay,
In New Zealand,
$12,000
zero.
medications
Because they
and
treated me like a
supplies,
human being, not a profit
$5,500
center.
total
But
hospital
here's what they don't
charges,
want you to know. I started digging.
$47,000.
How is this possible?
Now,
How can New
insurance
Zealand
would
just
negotiate
provide
that down
surgery?
and cover most
Turns
of it,
out they're not
but I'd
giving it
still
away.
hit my out-of-pocket
Here's the
maximum,
real secret.
$9,200
New Zealanders
for
fund this through
2025,
taxes.
or
It's built into their system.
$10,600 for
Healthcare is
2026
considered
under the
a public
Affordable
good,
Care Act.
like roads or fire departments.
That's the legal cap.
So I did the math on what I actually
But even
pay.
after paying
My cost in America,
$450 a
health
month in
insurance
premiums, I'd still owe nearly
$450 per month
$10,000.
equals $5,400
In New
per
Zealand?
year. Annual deductible,
Zero.
$6,000
Because they
per
treated
year.
me like a human
Average
being,
copays
not a
and
profit center.
out-of-pocket costs, roughly
But here's what they
$2,000
don't want
per
you to
year.
know.
Total I pay in America, $13,400 per year. And that's before any major medical event. If I actually need surgery, at another $9,000. In New Zealand, if I earn the same salary, healthcare is funded through general taxation. The effective cost works out to approximately $3,800 to $5,000 per year, depending on income. And that's IT. No deductibles, no copays, no surprises. That's a $7,000 to $9,600 difference every single year. And in New Zealand, I don't have to worry about which hospital is in-network, pre-authorization for emergency care, insurance claim denials, medical bankruptcy, surprise billing from an out-of-network anesthesiologist I never chose. Now, I know what some of you are thinking, but socialist healthcare means long wait times and poor quality, right? Let me tell you what I actually experienced. In New Zealand, walked into ER, 11 p.m., saw a doctor, 11:30 p.m., diagnosis and surgery scheduled, 1 a.m., in the operating room, 5 a.m., discharged with medications, next afternoon. Quality of care, exceptional, surgeon explained everything, nurses checked on me hourly, private recovery room. Cost to me, $0. Compare that to my friend Sarah in Ohio, who had appendicitis last year. In Ohio, arrive at ER, 8 p.m., waited for insurance verification, 1 hour. Finally saw doctor, 10 p.m., diagnosis made, but waiting for insurance pre-authorization until 6 a.m. the next morning. Finally got surgery, noon the next day, 16 hours after arrival. Quality of care, good, but she was in pain waiting for authorization. Her out-of-pocket cost, $8,900. Same surgery, same diagnosis. She paid $8,900 and waited 16 hours in pain. I paid $0 and was in surgery within 6 hours. And here's the kicker. According to the latest OECD data from November 2025, New Zealand spends about $6,100 per person per year on healthcare. America spends $14,885 per person per year. We pay more than double, and we get worse outcomes, shorter life expectancies, higher infant mortality, and medical bankruptcy. We pay more and get less. So why am I telling you this? Because while exact medical bankruptcy numbers are debated, millions of American families face financial ruin due to medical bills every year. Between 40 and 45% of Americans report having some form of medical debt. That's not a healthcare system. That's a protection racket. And it doesn't have to be this way. Countries like New Zealand, Canada, the UK, Germany, France, Japan, South Korea, they've figured this out. Their citizens aren't going bankrupt from cancer treatment or rationing insulin. It's not radical. It's just healthcare. Now, I'm not saying we should copy any system exactly. Every country's different. But we should at least look at what's working instead of pretending it's impossible. Because right now, Americans are dying, going bankrupt, and skipping necessary care because they can't afford it in the richest country on earth. This bill, this $0 bill, represents something bigger than one surgery. It represents a fundamental question. Do we believe healthcare is a human right or a commodity to profit from? I know which system treated me like a human being. If this video opened your eyes, do me a favor. Share it with one person who still thinks universal healthcare can't work in America. And drop a comment telling me, have you or someone you know been crushed by medical bills? What was your experience? What did you pay? I'm reading every single comment because this conversation matters and your stories matter. Also, and this is important, I've created a follow-up video breaking down exactly how 5 different countries handle healthcare, what they pay, and the outcomes they get. That video is linked right there in the end screen and in the description below. Don't let anyone tell you this is impossible. I'm holding the proof in my hands. Thanks for watching. And please, take care of yourselves, because in America, one emergency shouldn't cost you everything you've worked for.